to get started here, and you're welcome to continue writing and checking in using the chat. So good morning, good afternoon, or good evening from wherever you may be joining us. My name is Avi Stamen, and I'm the CEO of Academic Language Experts. Academic Language Experts, or ALE for short, provides customized editing, grant writing, and publication support services to researchers, scientists, and other professionals to help them produce publication-ready texts at the highest levels. We also assist scholars looking for help with their book proposals prior to submission to their dream publisher. It's our mission to help our authors achieve publication success and be a source of guidance and support throughout their entire journey. Thank you for joining us today for what I believe is our 19th publication success interview, where I engage in conversation with innovative thought leaders in the world of academia about how they are influencing the world of research in the hopes of helping authors to better understand the publication landscape and build bridges between authors, publishers, and funding bodies. Today, I am delighted to be joined by Zoë Mullan, Editor-in-Chief at the Lancet Global Health, a world-leading medical and global health journal. Chances are, if you're here, you would like to publish in the Lancet. Zoë is the Editor-in-Chief of the open access journal Lancet Global Health. She trained in biochemistry at the University of Bath in the UK before joining the publishing world back in 1997 as a scientific information officer with CAB International. She moved on to the Lancet in 1999, where she has worked ever since, variously as technical editor, section editor, and founding editor of the Lancet Global Health. Please feel free to go ahead, jump in on the Zoom chat and ask any questions or leave any comments that you would like. And we will try and get to them at the end of the session. It'll be an hour long, so stick around. Everything is being recorded, so you'll be able to rewatch and share afterwards. If you have a more personal question or want to discuss your specific research, you're welcome to follow up with Zoë or myself at the end of the interview or following in the next few days. And like I said, it is being recorded. So with no further ado, with great excitement, I want to welcome Zoë. Zoë, thank you so much for joining me today.
Thanks, Abby. It's great to be here.
Yeah, I really appreciate it. So we touched a little bit in your bio about, your journey to becoming editor-in-chief. It sounds like you kind of grew up within the publishing world, but maybe you could kind of tell us a little bit about your story and your path, starting from what would we say the first, starting out as like a technical editor, and maybe give us a perspective on some of the different positions that you filled and kind of how that prepared you for actually becoming editor-in-chief.
Sure. Yeah. So like you said, I'm pretty much an editor born and bred. I had a very brief flirtation with basic science research, but quickly realized I did not particularly like doing nasty things to rats. So moved on to the publishing world because I enjoyed the challenge, that the kind of critical analysis aspect of science and research, and also communicating complex ideas. And so, yeah, I moved into the Lancet very early on as a technical editor. So technical editors are what you might call a copy editor in the sort of mainstream kind of, news publishing kind of sphere. But technical editors, and these are all in-house editors usually in a sort of top-level journal like the Lancet, they're all employed full-time. And so they sort of we kind of call it micro peer review in a way. So once a paper's been accepted, the technical editors will sort of go through the paper line by line and make sure that it's internally valid. So the peer reviewers, the kind of external peer reviewers will check the external validity and to an extent the internal. But the technical editors do an enormous amount of very detailed checking of things like, whether the results in the tables match what the results in the written part of the manuscript say, whether the interpretation is okay based on the findings, and as well as just things like spelling, grammar, and just overall clarity. So that was a really good grounding. You get to see. You get to work on a lot of really interesting manuscripts, and so by that token you kind of get to see which areas interest you. So I had worked on quite a few papers in the sort of global health sphere, and so that kind of led me towards that area.
And if I understand, when you were working in the Lancet, there was no Lancet Global Health. So maybe you just tell us a little bit about how that came about.
Yeah, so when I started, there was just one Lancet journal. That was the Lancet Journal, which has been running for, well, nearly 200 years, 200 years as of next year. Yeah. And so, yeah, the first Lancet specialty journal, which is the journals, these kind of come out monthly rather than weekly. And they began with the Lancet Oncology in 2002 or 3, I think. And then they've been sort of rolled out successively over the years, and we're now standing at about 20 kind of monthly specialty journals, I think. And these are chosen on in areas that where we see a lot of research submitted to the Lancet journals, but we just don't have quite the room in the weekly journal. There's only sort of, you know, a set number of slots, and so you would end up, you know, rejecting what's actually really very good research, simply because you just don't have the room. So by kind of rolling out these sister titles, you can have a sort of cascade network, so that we make it more possible for people to publish by having more journals in different areas.
And can you define for us what you mean by global health, and like what sort of areas of interest kind of are under that guise of you know, of the journal that you're publishing? Because if you do the Lancet, you know, cardiology, I'm pretty sure I know what you're looking for. The Lancet Global Health maybe is a little bit more vague.
Yeah, so it's more about the populations than the subjects. So in global health, you could be looking at any subject area, really. It could be cardiology, it could be gynecology, it could be malaria. It's, you know, it's very, very broad. But what we're looking at, what we're particularly interested in, is health inequalities. So we tend to focus on what we call disadvantaged populations, and they can be disadvantaged in many ways. The most obvious one is by being in a low or middle income country. So the resources for health are not as abundant as they might be in a high income country. So the population is somewhat disadvantaged in that respect. But we also look at populations who are disadvantaged within high income countries, for example. So we might look at prison populations, or we might look at sex workers or indigenous people. So that's really how we define global health. It's about inequity, but it can cover an enormous number of topics.
And that sounds like a tremendous amount of responsibility to preside over such a journal, because I imagine that even within Lancet Global Health, correct me if I'm wrong, there are probably many more articles that are worthy of publication than you can actually publish. So how do you see your job as editor-in-chief? Is it to be a gatekeeper of best research? Is it to, you know, kind of culminate, you know, best practices in the field? Is it to, you know, bring in new voices that may not have been heard otherwise? Like, maybe you could just give us, you know, if you were to have to hire yourself, like what would the job description look like? What would that be?
Yeah, I think actually it's all of those things that you just mentioned. We are you know, editors, I think, have traditionally been seen as gatekeepers of the scientific record. So you know, we've seen in the particularly in the COVID era, this sort of infodemic, you know, where there's just information everywhere. And I think, you know, that there's been some discussion recently about you know, the value of publishers, the value of editors, and what I always come back to is this sort of curation element. How, you know, with all this information out there, how do you know what to focus on? How do you you know, where do you focus your attention? So editors are still gatekeepers to an extent, I think, but perhaps the better word is sort of curators. So you so we do see a large volume of submissions, and and because we see such a large volume, of course, looking across these different manuscripts, you can relatively easily compare them, because they're you know, there are so many coming in every week. So so we're looking at methodological robustness, things like that. So you know, are you going to be able to make reliable decisions based on this information in this manuscript. Are the results reliable? Is it novel, for example? So we're always looking for information that's novel in some way, because if you're just, you know, kind of doing research that where the research question is already, the answer to it is already known, that's kind of that's not something we're looking for. So it's really focusing on what's the most reliable and important in a particular area, and trying to avoid anything that might be flawed or just insignificant. And of course, we do that with peer reviewers. We're not doing it on our own. You know, what we think of as the most reliable and important are then handed over to our peer reviewers. And also our role as an editor is to have this enormous kind of black book, if you like, of experts to look at the work. So we're kind of independent sources of the most reliable and appropriate peer reviewers for anyone's work.
And to what extent would you say that, you know, you and your team kind of sit down the beginning of every year or whenever and decide on an agenda of like, these are the topics that we see are trending, this is what's really important, this is what we want to do to move our field forward? Or to what extent are you a reactive body which kind of takes a look at what's coming in and says, well, okay, this is really, you know, foundational research. It may have been off our radar, it may not have been something that we kind of marked as a priority, but we see the importance of it. So is it more of a proactive or reactive role, and, you know, as editor-in-chief and as the journal as a whole?
Yeah, it's a mix, I think. We do I wouldn't say absolutely every year, because some years, well, actually we did in COVID. I was saying some years you just get COVID research, but still within that we had to prioritize what were we going to focus on, and so we did take the decision there to focus on the sort of indirect effects of COVID. That lots of other journals were, like infectious disease journals, respiratory medicine journals, were focusing on the direct effects of COVID. And we saw a niche for our journal in publishing research that was looking at the indirect effects. So disruption to vaccine programs, for example, or case notifications for TB, things like that. So we kind of, and then you start to publish that kind of thing. And you can also issue calls for papers if you identify an area like that where you see a gap. I think that's what we're doing essentially, is we're having a very broad overview of the field and we're seeing where the gaps are. So if we can see through all the papers that we're receiving and publishing, if we can see that there in some areas there's a large amount of modeling or imputation going on simply because the empirical data aren't there, we can actually then highlight that to the community and say, you know, look, we're really going to try and encourage primary research in this area because we've noticed these gaps. So that's an area where I guess we can be slightly more proactive. But we do respond also to the community. You know, we're there essentially for the researchers. So we can do things like we can consult our international advisory board for topics that they believe are somewhat neglected or upcoming in their particular spheres. We can attend conferences, and simply by seeing how many people are in the room for different sessions, you can go, well, okay, this is a hot topic and we need to be looking at this area. So it's a mix. Yeah, it's proactive and
yeah, that makes perfect sense. And what would you say are some of the topics that you would, that you're looking at closely now that are of particular interest? Obviously, scholars aren't going to drop what they're doing now and necessarily start working on these topics, but, maybe it's helpful to hear about what some of the important topics are that you're kind of looking at a little bit closer and see if there are connections to their line of work or, how that might tie in.
Yeah, I think, yeah, it's probably useful to kind of outline some of the areas, such as things like multimorbidity. This is an area where we're really going to be trying to encourage more work. And so this is an area where We've got aging populations around the world. We've got health systems that in a lot of countries are still set up for infectious diseases. Largely, they're not set up to deal with these chronic conditions, and they're certainly not set up to deal with multiple chronic conditions that require a good degree of interdisciplinarity in the treatment. So there's actually not very much research out there on multimorbidity. So that's definitely an area we're going to be looking at. I think climate change and health, another one. You know, this is obviously, they're massive global topics that, you know, have a bearing on health. So climate change, conflict and health are definitely areas that are of concern to all of us, really. And so, you know, are big hitting areas for future work.
So if I'm going to read between the lines, it sounds like you encourage interdisciplinary work in that sense, right? Meaning not being afraid to just, you know, take your work that's may relate to other fields of research that are classically divided and actually bring them together for an article in Lancet Global Health. Is that accurate?
Yeah, I mean, I think interdisciplinarity is going to be essential for a lot of our health challenges of the future. So yeah, you know, climate change and health, we need to get people thinking about, you know, deforestation with people who are thinking about lung health, or, you know, it's definitely necessary for the future, and we definitely encourage it at the journal. Yeah.
Got it. And were you editor-in-chief during the pandemic, or during the heart of the pandemic? You were. So yeah. First of all, yeah. I don't know how you're still here, because I've spoken to a lot of folks who were in the publishing industry and just got totally kind of overrun by all the work that was, you know, that came at them. You know, I don't want necessarily to take you back there to, you know, tell us blow by blow exactly what happened, but I am curious, maybe if you can reflect a little bit now. You know, I'm not going to say it's over, because there's still places where the numbers are quite high, but you know, and kind of reflect on, you know, what you know you learned from that process, you know, of trying to deal with just, I guess, the sheer quantity of volume and the importance of getting it out quicker, and, you know, and validating the studies that were coming in that were really critical, that kind of is maybe made an impression and left positive change, you know, moving forward.
Yeah, I mean, it was really challenging. I mean, I don't, you know, I'm not trying to say for a minute that people in publishing had it the worst, of course not, but it was, we were, you know, all of us were duly sort of struggling with the challenges of working remotely, because, you know, everybody suddenly was, as everyone went into lockdown, but also, you know, with the fact that our workload sort of tripled in a matter of a couple of months. So we did have to make some pretty big sort of adjustments to the ways we were working, and it was a real pressure, because especially with, you know, journals like the Lancet, where you are often seeing some of the absolutely crucial cutting edge, almost life or death information coming in, and wanting to disseminate it as quickly as possible. But of course, equally being aware of how much is hanging on that, you know, and so the need to maintain the editorial standards is almost greater. So so you have to do almost more with less time. And so it was a real challenge. And I don't think we got it. We definitely didn't get it right every time. But we had to be quite ruthless, actually, sometimes, because the volume of work was such that we could see that there was lots of submissions coming in that were of very low quality, and so, you know, we had to be quite ruthless and just say, well, we can't even consider them for peer review. We just don't have the capacity. So, you know, our rejection rate went through the roof. But, you know, hopefully we were still able to focus on those ones that we found to be the most important and get them peer reviewed, and all credit to the peer reviewers, because sometimes peer reviewers were turning reports round in 24 hours or less, and so I just really don't know how they did it. Yeah, it was a very, very challenging time.
Do you find that the number of submissions has gone back to pre-COVID levels, or is it still up from what you were seeing back in 2018, 19?
I think it's pretty much back to where it was, actually. Yeah. I mean, we're a relatively young journal, so submissions are sort of steadily going up every year anyway. So, but we're probably on a pre-pandemic sort of trajectory now. So we had a blip, but it's definitely come down again. Yeah. Yeah.
Okay. This has been really interesting and insightful background, but I do want to get to some more practical, questions and challenges that some of the scholars here might face. It's also another opportunity to just remind everyone that you're welcome to ask any questions using the chat feature. We'll open up the mic at the end of the session. But maybe you could start by just telling us, kind of what are some of the most common issues that you see with submissions coming in that you would advise scholars to kind of look out for and make sure they're taking a look at before they submit to Lancet Global Health that may improve their chances of getting accepted?
Sure. Well, I think probably the first thing just to say up front is that there's no way you can write a paper up in a way that's going to be accepted if it's a poorly thought out research question and method in the first place. So, I think sometimes I'm asked kind of how can I write this up in a way that'll make it accepted, and of course you just can't do that sometimes. It's back to the drawing board for the whole research project.
Yeah.
But I think a lot of the time the mistake, or the thing that people miss when they have done a great study, and of course they know it inside out, they know how important it is, but it's actually spelling that out to an editor sometimes that is missing. So it's making it really, really clear how you've done some research kind of before you've set out to do the project, to identify what the research gaps are. So lay out what's already there, lay out kind of what's missing, what's wrong with the research that's gone before, what are the limitations, and why did you therefore set out on this path to do this piece of research. So it's making it really, really clear what's the point, I think, of the research. You may have a beautifully done thing, but if you can't demonstrate the added value of it in that vast volume of information that's out there, it's not going to grab the attention of an editor, and it's not going to grab the attention of a peer reviewer, and it's probably not going to be, highly cited or whatever your kind of outcome measures are. So I think that's it. It's putting the research into the context of what's already there is what is most commonly lacking.
Yeah. And if I can parse what you're saying into two, I would say that it sounds like part of the issue, part number one, is making sure that the study itself actually is filling a gap in the research which exists and which is important and it's justified. And then part two is being able to communicate that you've done that. There may be folks who have really done that work, but because they're so deep inside of the project and they've been living it for 2, 3, 4 years, it's hard for them to take a step back and say, okay, how do I explain this to someone who may be familiar with the field in general, but may not be a subject expert in exactly what I'm working on. So I think that's, and when we talk to our clients about our editing services, we talk more. We say it's not just about whether the grammar is technically correct or not correct. That's something that can be overcome. It's more a question of clarity and understanding, and are the points that you're making going to come out as clearly to the reader as you're intending to make them?
Yeah, I think often I get asked the question, what does a good covering letter look like? Or how much notice do you take of the covering letter? And my usual answer is that I don't take a great deal of the notice of the covering letter, or I shouldn't need to. That's my argument. So if you have a really great point to make in your covering letter about why this is a really important manuscript to be published, it should be in the paper itself. That the essence of why and why a paper is important should come across in the narrative of the article itself, because only the editor will see the covering letter. The peer reviewers won't see it. The readers won't see it. So why not incorporate that message into the text of the manuscript?
I agree with you. I would only push back and say that I've seen studies of editors, and I assume this is not you, but I have seen studies where they talk about how, if they're not persuaded by the abstract, maybe the cover letter last, but the abstract, then they may not go on to read the entire article. So I think it is important, sometimes scholars, researchers forget about the abstract till kind of the last minute and then write something quickly. But I think it's important not to overlook that part of it, because the first impressions are important. And if you're 3 or 4 pages in and you've yet, as the reviewer or as the editor, you've yet to understand exactly what the, what the conclusions or what the big, finding is, that may, kind of stilt your reading of the remainder as much as you try to remain unbiased.
Yeah, agree.
Okay. And, if obviously scholars and researchers are pursuing research that they feel is important, and oftentimes I think people have personal connections to their research in terms of how which topics they're choosing and how they go about them. But is there a more kind of strategic way of planning research so that it is kind of that it can be attractive and it can't be interesting to general populations, that can be thought about in advance, maybe already at the grant funding stage, when you're applying for grants? I know that's a bit generic, but just trying to think about, strategic planning when it comes to, I'm thinking ahead the next 5-10 years, what topics do I want to be trying to tackle and take on?
Yeah, I think that's a tricky one, and it does to an extent come down to the grant stage as well. And I think funders have more, even more influence than a publisher or an editor would have in terms of directing research at that level. At the sort of very, very first stage, because they will issue requests for proposals on certain topics, and so to an extent you're a little bit pigeonholed by that sometimes, perhaps. It's tricky for me to say. I think it's hard for an editor to be able to project that far in advance, because as I've mentioned, we can see what's currently hot, we can see where some of the gaps are, and we can issue editorials outlining where we've noticed gaps, and we can issue calls for papers. But at that stage, it's a bit late for people who are planning their research. It's a tricky one, I think, for an editor to be able to direct. It is much more, I think, to do with the grant bodies.
But I imagine that so maybe you're right. The healthy way to look at it is kind of take a look at what funders are going to be, what trends there are in terms of, whether it's ERC or NIH or NSF or whatever it may be, try and see kind of what won last year, or what calls are they going for this year, and see whether there's any connection. Because I imagine that, what's happening further upstream probably does impact what you're going to eventually see in some of the leading journals. Whether or not, we agree with their priorities in terms of what they decide to fund, that's a different question. But oftentimes there is a lot of thought and time and energy invested into those issues, and it's worth being aware of it at the very least. Yeah,
and I think there is a certain cyclical element to that as well. So if funders, for example, see a piece of work published in a journal like ours, and they see the response it's got from the community. So we published a commission on high quality health systems in the Sustainable Development Goal era, which had a massive response. It's been cited about 1,000 times, I think, in 4 years. And so now funders like the Bill and Melinda Gates Foundation, they do pay attention, I think, to what is received particularly well, and may well direct their funding preferences towards things like that. So there's a kind of a bit of a symbiosis, I think, between the two.
Got it. I want to talk about a topic, about an initiative actually that you started maybe with some of your colleagues that I really kind of loved and connected to, and having to do with multilingualism and scholars for whom English is an additional language, which I know that the majority of our clients fall into that category. I imagine most of the folks here today. And that's a real disadvantage in many ways. It's hard enough to get an article published without having to do it in your second, third, or maybe even fourth language. So tell us a little bit about the translation of abstracts, which is a new kind of initiative that you've launched. What brought that about, and kind of how it works?
Yeah. So yeah, you're right. I mean, writing a manuscript in a language that isn't your first language is tremendously challenging, and I salute all the researchers out there on this call that are doing that. I'd just say that, you know, certainly from a Lancet journal perspective, having perfect English isn't a barrier to having a manuscript considered. So, you know, as I mentioned, we have those technical editors. And so as long as it's understandable, that's the thing. As long as you can understand the importance of the manuscript as described in your writing, that's the main thing going forward. But the way we were looking at it was from the readability perspective. So once you've published your manuscript, in terms of communicating it and having people be able to access it, that's the angle we were looking at. So we're an open access journal, which means that you can read all of the content on the journal without having to hit a paywall or register to read any of it. So it's all completely free to access at the point of publication. But when we were thinking about open access, or, you know, accessibility more generally, we started to look a bit beyond the financial. So, okay, you might be able to afford to read it, but can you understand it? Is it in a language you can read? And of course, our material is all published in English. So the answer was no. There's a potential accessibility barrier. So we started looking into the possibility of translating abstracts, and we've looked at it before, and we kind of got a bit stuck because it can be quite an expensive process. Kind of getting it into your workflow can be a bit tricky. You know, what languages are you going to decide to publish? Are we just going to do it in French? That still, you know, excludes a lot of the population of the world. So what we decided in the end was to kind of to offer the opportunity for authors themselves to translate the abstract of their finished article, their accepted finished article, into a language that they believed was relevant to the audience. So it could be any language, and then or multiple languages, in fact. And we kind of worked out a way to fit that into our workflows that wasn't too disruptive. So currently they're being published as sort of supplementary material, and not all of the papers have them. As I say, it is an option for the authors, so it's up to them to do the translation and to submit it, and we'll publish it as supplementary information. But we're still working on it. You know, it's still not perfect. They're not quite as accessible as the rest of the manuscript. They're not searchable on PubMed, for example. So we're working on ways to have that incorporated. But the feedback so far has been pretty good. So we're definitely going to keep with it, and we're going to keep improving it, hopefully.
Do I remember correctly that you generally will do up to 6 languages, or did I hear that wrong?
I mean, for our commission that I just mentioned, I think there were more than that, but that was slightly different. But there's no particular limit. No, I mean,
okay.
No.
Got it. And so this is really interesting within the context of making research accessible for the populations that need it most. You know, I think that one of the reasons, you know, probably even though it's a global journal and it's an international journal, most individuals are doing their research in a particular country or in a particular geographic location, or maybe in a few locations, but, you know, it really is kind of, the results can be very practical for decision makers, policymakers, doctors, any one of a number of people. So what other things, aside from the translation of the abstracts, which is really great, what other things can be done to make sure that the research that's being published actually gets to the populations that need it most? Because as you said, you know, especially around the pandemic, but even afterwards, this isn't just theoretical. In fact, it sounds like a lot of the pieces are very much practical and should influence policy. So how do you get from the, you know, obtruse, sort of sometimes convoluted and you know, academic paper, which is kind of just the way that we write, to you know, real life implications and ramifications?
Yeah, that's a really important aspect of it. I mean, yeah, we can make it we can make it accessible, but can we make it understandable? Or yeah. So I mean, some journals have started to publish lay summaries, which I think is really interesting. But again, it's an extra addition to the workflow. And again, I think mostly the authors are being asked to write a lay summary themselves, which is easier for some people than others. You know, actually, it's really hard to find a great scientist and a great writer in the same body. So I think, you know, there's also a way to go on that front. You know, we can issue press releases sometimes if we think a piece of work is particularly important for general readers. So somebody who wouldn't normally be browsing a medical journal, we can issue press releases, and those are written by press officers who will translate it into lay language for journalists to write news articles for. And sometimes they can be geographically targeted. So our press officers might have a group of journalists that they know in India, for example, if it's a paper that's particularly relevant to that region or elsewhere. So we can try and do that using our contacts. We've also got things like Twitter and Facebook, obviously, so we can get better reach there. But again, the way that we translate that into language that's understandable is still limited. I mean, we can try and reach more people with those social media outlets rather than just, again, relying on people to sign up for a table of contents alert or something. But yeah, and of course the wonders of Twitter. It's not always it's hard to encapsulate a really complicated article into 230 characters. So
for sure.
there are limitations all around.
Yeah, I will take advantage of this opportunity to do a shameless self-promotion that we do. We do we've been piloting over the last 6 months, approximately, both lay summaries, donor summaries, as well as public policy reports and press releases. So, you know, if there are scholars who have written an article, got it published, are really proud, want to get it out to a broader audience, as long as it has to do with writing, that's something we can help with. I know there are other folks who do videos and they'll do infographics. That's less our forte, but those are also really great ways of kind of getting research out there to a broader audience. You know, whose responsibility that is, and is there funding to support it? That's obviously an important questions that need to be answered. But if you do have the ability within your next grant proposal to request, you know, to add a line about research dissemination, I think they're expecting it, and I think it's important to include that.
That's great advice. Yeah.
Are there, what would you say, you know, whether you personally or your team, what is sort of the next? Well, let me preface this question by saying that I don't think it's would come to a surprise that some authors find the publishing process to be frustrating or tedious or, you know, anxiety filled. And I know that, you know, publishers are making efforts, you know, sometimes these things happen faster, sometimes slower, to ease the process for publishers. What would you say is currently, in your experience, is the biggest challenge that you're facing to try to make the process easier for scholars? And what would you say is like highest priority that we should really be focusing our attention on to really kind of make the whole process a little bit less painful and a little bit more of a positive one for authors?
Yeah, I mean, I think, you know, if we had some kind of universal submission platform, wouldn't that be great? I mean, you could just, everyone use the same platform. You could just, you know, submit to one journal and they said, no, sorry. So you just, I don't know, pressed a button and you could just send it to another journal. I mean, of course, that happens within publishers, you know, so.
It sounds like a pipe dream. I actually am inspired by the legal, by law, because there is a, you know, different but similar model in legal, at least with the law reviews, where you can submit to one place and it gets sent out to a number of different places. But anyway, I know that that would require some serious transformational change, which I don't think I see coming.
You know, it's high level dreaming, but I think that's I mean from what I hear, that's kind of one of the major bugbears. Time to review is another one, but I think that's you know, that's difficult because we're relying on peer reviewers, and peer reviewers are also researchers and writers themselves. So you know, it's it's a tricky one. You could, drop your standards a bit, make it quicker, but would that be a service in the end? I think, probably not. It's worth, it might, most authors will reflect that the wait for peer reviews, if they're high quality peer reviews, is usually worth it. So just having a responsive editor is important, I think. If you've got a slightly protracted review process, that goes a long way to kind of reassuring you. But I think the submission is the main thorn in most researchers or writers or would-be authors' sides. Really.
Yeah. And this may or may not connect to that, but what would you say, if there is one thing that you want to accomplish in whatever time you have as editor-in-chief at the Lancet, maybe something that really is more personal, something that you really feel passionate about. What do you see as kind of like your mission? Maybe something you haven't accomplished yet, but you'd like to be able to over the next few years.
Yeah, I mean, I'll have been editor-in-chief for 10 years next year as well, so that's another little anniversary. But I think ultimately I'd quite like to sort of do myself out of a job. I think I feel increasingly like the editor of a global health journal, which focuses largely on lower middle income countries, should perhaps not be edited by somebody who's sitting in an office in London. So my sort of aim is, I think, to kind of gradually retreat myself out of the editor's chair and be replaced by somebody who's actually working in a low middle income country. And we've done this. We've managed to successfully recruit editors in regions other than the sort of US, UK, Geneva regions where you might think you'd find editors of top journals. So we have now rolled out a suite of journals called regional health journals. So we have Lancet Regional Health, Western Pacific, Southeast Asia, Europe, and also Americas. And the editors of those journals are embedded in the regions. So we have a couple of editors in Chennai, we have a couple of editors in Rio, in Beijing. So that's where I see my journal going, is somewhere outside the UK.
Yeah, and I'm sure that there's just by engaging in dialogue with those folks that you're in touch with, probably enriches the conversation and brings it into directions which I imagine that an editorial board that was all sitting in London might not be able to do on their own.
Right.
Brilliant. Zoë, this has been really great. I know I personally have learned a lot, and I'm sure that the audience has as well. I want to leave enough time for questions. Again, anyone who wants to write a question is welcome to. We'll also open up the mic for anyone who wants. Just quickly before we do that, if anyone wants to be in touch with either Zoë or myself, you are more than welcome to do so. If you have questions about Lancet Global Health and publishing there, please do feel free to be in touch with Zoë. You can also learn more on the Lancet Global Health homepage. And anyone who wants to learn more about our author assistance, author research support services, whether it be language or content, you're welcome to be in touch with myself. We do translation, editing, grant reviews. We help early career scholars with coaching. So all sorts of different services that you can receive when working with us. So you're welcome to be in touch with either of us with any follow-up or questions. In terms of coming up, we have a few events coming up over the next few weeks that you may be interested in. I will be teaming up with Garrett Dyke from Research Square. We have a series called Ask the Publication Experts. That's a little hubris on my part. I wouldn't say I'm an expert, but Garrett definitely is. And we're going to be talking about how to identify research gaps and develop your research question, which I did not know Zoë was going to be discussing today. So if you do say to yourself, well, ooh, that is something that I need more practice in, this is a great opportunity. And Alana, our marketing manager who does a wonderful job month in, month out, will share the link momentarily in the chat. You're welcome to sign up for that. There was also, so that's coming up, I believe, next week. Another on November 2nd, which is next week, we're going to be doing an event with eDance on how to craft a winning book proposal in 5 steps. So I know if you are considering at any point putting together a book and not just a journal article, the process is a bit different. Putting together a strong proposal is really critical to your success. So I encourage you to come and learn more in that session as well. So yeah, and we do these, we're oftentimes doing multiple events a month, always educational, always free, to really help researchers push their research forward. So now I just want to, and again, Alana will share those in the chat, and you're welcome to sign up at your convenience. I want to open it up now to the folks that are here. Maybe just, you can unmute yourselves. Let us know who you are. Give yourself, just tell us your name and where you're chiming in from, and any questions that you might have for Zoe or for myself, but I recommend asking Zoe because she is a wealth of knowledge. I never know when there aren't questions, whether it's because we have put everyone to sleep or whether it's because it was so clear and interesting that everyone has gotten all their answers already answered. But I know that not everyone necessarily wants to chime in front of everyone. If anyone wants to ask their question privately, anonymously, you're welcome to send it to me also privately, and I can ask Zoe. Cohen, I know you had a few comments in the chat. Was there anything that you wanted to specifically ask about? All right. Well, then I think we're pretty much good to go. Maybe we'll just again, anyone is welcome to chime in at any point. Maybe we'll just finish off one last question if I've already got you, Zoe. Can you share with us any interesting stories or dilemmas that you faced in your time as editor-in-chief that you're allowed to share with us? That any anecdotes about I don't know, ethical dilemmas that you came across, or funny, surprising situations that that we may find interesting?
Without giving too much away.
Yes.
I mean, yeah, we've come across sort of our fair share of research and misconduct. And I remember I hadn't been at the journal too long, actually, and there was a situation where we had published a manuscript. It was regarding the Indo-Mediterranean diet and its effects on some cardiovascular outcomes, I believe. And it was published, but quickly there was some questions asked about the validity of the findings, and we have to take questions like that quite seriously. And often what we end up doing is asking the research institution, to actually do an investigation for us, because editors aren't investigators or policemen, so we just don't have the resources or the mandate to go ahead and sort of do investigations like that. And in this situation, the research institute was slightly unfamiliar. There was no kind of obvious research integrity office to contact. So actually one of our reviewers took it upon himself, who had reviewed the manuscript, to actually go and visit the site, and to look at the raw data, and to kind of verify that the findings were solid. So he traveled to a country which will remain unnamed, and he went to the lab and tried to access the primary raw data, which in those days was almost always in paper form, particularly in this particular area of the world. And he arrived and was told that unfortunately all the raw data had been eaten by termites.
The modern day version of my dog ate my homework, I guess.
Yeah, that's right. So unfortunately, so as an editor, there you're in a situation where you can't actually prove one way or the other whether research misconduct has taken place. But you can't sort of sit back and pretend that nothing has happened and no one's raised any concerns, but also you can't kind of go ahead and retract the piece because you don't know for sure. So So in those kinds of instances, we have to publish something called an expression of concern. So this manuscript now has an expression of concern on it. Oh, then maybe it was eventually retracted. I forget. But at the time, when the termites hit, we had to issue an expression of concern. And I believe the termites were actually mentioned in the notice. So if you Google Lancet Indo-Mediterranean diet termites, you might find it.
Nice.
But yeah.
That's great. That's great. I actually interviewed the folks at Retraction Watch about a year ago, and they do a lot of good work around, making sure that, articles that are problematic are reported and, retracted when it's relevant. And I understand that it's not a simple process whatsoever, because you want to, we do the peer review, but we obviously can't, we don't always have access to the raw data and don't always have the ability to check every single last bit, but we rely on the communities of researchers to really kind of pick something out when it's fishy. And I think that's sort of the best way to go about it, because we're all fallible, and it's important that the academic record stays as consistent and honorable as possible. So yeah,
that's another major role of editors actually, is to ensure that happens. So if you imagine cases where research is just plonked onto a database somewhere, and hooray, we avoided those nasty editors because we just managed to publish our research without having to go through all that. Who's making sure that paper is the integrity of that paper is maintained? If something goes wrong with it, who's flagging it up? Who's saying, this has a problem with it? So yeah, I think that's another important element of what we do.
Yeah, I was surprised in my discussion with him about just how prevalent fraud seems to be. Meaning, you sort of, I naively thought that maybe this is a problem that happens once in a blue moon, but in fact, it seems to be becoming more and more of an issue, which editors kind of need to look out for and make sure that they're taking into account.
Yeah, well, I think as there's more and more pressure to publish. There's more and more corners being cut, at the least, and at the worst, downright misconduct happening. So yeah, there's and there are some serious incentives involved sometimes with publishing in high impact journals. So the stakes are quite high sometimes. Monetary rewards, that you couldn't imagine in certain countries for publishing in high impact journals. So those kind of perverse incentives are really problematic, I think, in terms of trying to ensure a culture of trust and integrity.
Indeed. Zoe, thank you so much for your time. This has been really interesting and insightful. And I think I can speak on behalf of all the attendees, although they were quiet today, in saying that we really learned a lot from your insight and experience. And I thank you for sharing that with us. And I think that, especially anyone who's watching this now has a better idea of kind of what the role of an editor does. I think that's really important, because a lot of times there's misunderstandings, I think, from the researcher side about, kind of how the journal conducts their business. So it's really shed a light on that. And also just in terms of, strategically thinking about our priorities in research moving forward. I think it's helpful for those in global health, but also helpful for other folks who might be publishing in other journals or submitting to other journals, because a lot of what you've, told us today really is relevant for those as well. So thank you for your time. Greatly appreciated. And looking forward to continuing further conversations in the future.
Thanks, Abby. Thanks for having me.
Brilliant. All right. Thanks, everybody. Take care.